I'm Amanda Peterson, Deputy Director of Youth and Prevention at Mental Health Recovery Board serving Warren and Clinton counties. I'm hoping this short video on suicide prevention will help people struggling and provide resources for their loved ones too. Suicide prevention is personally important to me because I lost two friends who both died from suicide when I was a teenager, and the losses have significantly increased since then. The Ohio Department of Health reported from 2007 to 2018, the rate of youth suicide in Ohio increased 64%, and suicide is the second leading cause of death in Ohio among 20 to 34 and 10 to 14-year-olds. And kids even younger than 10 have died from suicide. As a parent with younger kids, I was worried about things like street safety, not thoughts of dying, but the data shows it's important to talk to your kids about how they are feeling. Whether it's your loved one or you personally, it's scary having these thoughts and can be overwhelming trying to figure out how to help. 988 is the national suicide and crisis number you can contact 24/7 by calling, texting, or chatting online. In Ohio, we also have MRSS, mobile response and stabilization services as an added support for youth and their family. During a mental health crisis, you can also go to your nearest emergency room or hospital for assistance. If it's not currently a crisis, for example, there are no suicidal thoughts, but you've noticed some of the risk factors, it's important to get professional help like counseling. In Ohio, the Alcohol, Drug Addiction, and Mental Health Boards are responsible for planning, funding, monitoring, and evaluating local behavioral health services. You can search online to find your local board. For Warren and Clinton counties, our website is www.mhrbwcc.org. Our website includes a list of local agencies we contract with for services. MHRB funding is based on clinical and financial need, which means a sliding scale is offered at contracted agencies, so financial concerns aren't a barrier to accessing care. It can be helpful to make a coping plan for yourself or safety plan for your child when everyone is calm. This is something a counselor can help you make. An example is listing supportive family or friends you can call and having the 988 crisis number and nearest hospitals listed for reference. Even if you know these things, it's helpful to have them written down because it's hard to think clearly during a crisis. Also, make sure to keep the plan somewhere you can easily find it. For example, some people save it in their phone. You should also list coping skills, things that make you feel better or at least distract you from the negative thoughts. For example, there are a lot of different arts and crafts people enjoy: playing music, journaling, caring for pets, gardening, playing games, or exercising. A good grounding technique is to find 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Another useful tool is tapping or emotional freedom technique, which involves tapping on different acupressure points and has a calming effect. There are trainings you can find online to learn more. Other healthy lifestyle reminders: sleep 7 hours, eat healthy, get enough sunshine and vitamin D, and get out in nature. Exercise is always recommended for health, including mental health, whether it's high intensity workouts or doing yoga or going for a walk. There are some protective factors that reduce the risk of suicide. Some example protective factors are coping skills, problem-solving skills, a sense of belonging, having support and healthy relationships with family and friends, community connection. For youth, this would include school, having safe spaces both physically and emotionally, reasons for living, access to behavioral health care, religious beliefs, and reduced access to lethal means. Lethal means safety is reducing access to or putting time and distance between the person and the means. Firearms account for over half of the suicide deaths in Ohio and nationally. Firearms are the most lethal means, with 90% of attempts ending in death. People rarely substitute a different means if they don't have access to their original plan. But when it comes to firearms, even if they did substitute, other means are less lethal and increase the chance of survival. Lethal means safety for firearms includes things like using gun locks, firearm safes, and keeping your gun unloaded and separate from ammunition. You can also have your firearm stored somewhere else temporarily, for example with a friend or family member, and some businesses offer temporary firearm storage. The businesses are trying to increase firearm safety, so the reason could be crisis related, or even things like grandkids coming to visit for the weekend and needing to ensure your firearm is secure. For medications, there are medication drop box locations to properly dispose of your old or expired medication. You can get medication lock boxes to store active medications and list the poison control number for any medication overdoses. Naloxone or Narcan reverses an opiate overdose, which includes suicide attempts with pain medication. There are currently resources providing free naloxone to reduce overdose deaths. What are some risk factors? If someone has suicidal thoughts, that's a big risk factor and should be taken seriously. Also, having a history of mental health or substance abuse concerns or a trauma history. Any significant behavior change, for example, sleep changes or anger that is abnormal for that person. Other risk factors are loss of relationships that could be family or friends, social isolation, and bullying, as well as impulsivity, hopelessness, feeling worthless or like a burden. Some barriers include the fear of stigma asking for help, limited economic supports, and limited access to mental health care. The term suicide contagion describes the increased risk if a family member or friend has recently died from suicide. That's why post-vention efforts like suicide loss support groups are important to prevent additional losses. What else can you do to help? Offer support, ask questions, including about suicidal thoughts, and listen empathetically, non-judgmentally. The questions you ask kids are slightly different. For example, have you had thoughts of hurting yourself? Get professional help. Again, if it's a crisis, call 988 or go to the nearest ER. If it's not a crisis, but you've noticed risk factors, schedule an appointment for outpatient treatment or counseling. If possible, stay with your family member or friend until their appointment. Reassure them that they won't feel like this forever and services are available to help. Observe changes in their behavior, provide resources, and remove access to lethal means. You can help reduce stigma by comparing a mental health crisis to a medical crisis, like treating a heart attack. If someone was having a heart attack, you would want them to go to the ER, take any needed heart medication, and get the treatment they need to stay alive. The same is true for a mental health crisis. There are trainings you can take to get more in-depth information. For example, QPR, Question, Persuade, Refer, Mental Health First Aid, and Zero Suicide trainings. For Warren and Clinton counties, MHRB funds school-based and community prevention services, including suicide prevention, so resources like QPR trainings are free to our community. Parenting is hard without the added challenges and stressors today, and kids are affected by their parents' stress and well-being. So MHRB also funds parent coaching and education to support families. Some care transitions are a higher risk for suicide, for example, from jail or psychiatric hospitalization back to the community. MHRB funds positions that specifically address this need, including a hospital specialist and jail clinicians in both counties. These clinicians link people to outpatient treatment to receive the ongoing care they need. MHRB also identifies gaps in our system of care and adds resources to best support our counties. For example, law enforcement identified a need as they sometimes repeatedly receive calls to check on someone that they are concerned about, but that isn't severe enough to meet criteria for hospitalization and is not yet connected to treatment anywhere. MHRB added a position in both Warren and Clinton counties that law enforcement can contact for assistance. The clinician will go to the person in the community and work to build rapport and connect them to resources to best meet their needs. Hopefully you found some of the tips in this video helpful. Remember, it's okay to not be okay. We are all human, and resources are available to help you or a loved one feel better.